Hi guys, this is Sani Nclex-rn and welcome back to my channel. Today we are going to talk about the drug calculation formula for the Nclex-rn exam. And trust me guys, this is something you must know before you sit in your Nclex-rn exam and before you start your practice. Drug formula are extremely important for every single nurse. It doesn't matter about your status if you are a student nurse, full-time, new grad, part-time or PRN nurse. Medication calculation are part of everyday nursing practice. Getting them right is just not about the passing the NCLEX exam, it is about the patient safety. One small math error can lead to a medication error and also it can harm the patient life. So yes, this topic is most important, but don't worry, I'm going to break it down in a very simple way and easy to understand. And we will solve the problem solving question together. So grab a pen, some paper and calculator if you need it. And let's break these drug formula down step by step. Important note for drug calculation is the first key of success, and before you jump into solving doses calculation problem you must know few important things. The first one is basic pharma conversion rate, second one is basic math. These conversions are used every single day in nursing practice. If you memorize them once they will help you throughout your entire nursing career. And I would advise you guys, I do have some important notes, some important conversions like basic conversion rate, unit conversions, abbreviation, meal time terms, and percentage solution. Some of them are so important, and I would advise you please take a screenshot of these table and keep in your phone for a quick revision. They will help you throughout your entire nursing career. So guys, these are the fundamental of drug calculation, those table that I'm going to show to you right now. And before solving advanced problem you need to just make sure 100% comfortable with them. First one is charting abbreviation and second one is basic pharma abbreviation. Take a screenshot of both tables. And third one is pharma convergence rate. This is so important while practicing your question in pharma, even in your real world practice in hospital or even for your Nclex-rn exam. So this is the most important thing you must know about unit conversion rate. You guys take a screenshot of all these tables in your phone for revise them regularly. Once these basic are so strong, your drug calculation become easy, logical and safe. All right guys, let's move on some basic formulas and practice a question. Our first formula is patient weight in kilogram multiply by prescribed dose. Let's practice a question by using this formula. A physician prescribed Tylenol 15 milligram per kilogram per dose and the patient body weight is 80 pounds. How many milligram per dose should the nurse administer? Always the first step and first rule, convert pound into kilogram and each kilogram has 2.2 pounds. So our ratio is patient weight is 80 pound and you got to divide by 2.2, and then if you break these number down your patient weight is in kilogram 36.36 kilogram. Then apply the formula here, patient weight in kilogram multiply by prescribed dose per kilogram. So patient weight is 36.36 kilogram and multiply by the required dose 15 milligram. So your answer would be 545.4 milligram. But you got to remember guys, we don't write in points milligram. So usually round it to 545 milligram if rounding to the nearest whole number. Just to be remember some key point, if you forget to convert pound into kilogram your answer will be wrong. Weight based dosing always start with kilogram. Our second formula is desired dose based formula. This formula is pretty simple and straightforward. The formula is D divided by A multiplied by Q, and D stand for desired dose, A stand for available dose whatever we have in our hand, and Q stand for quantity. It could be in tablet form, milliliter form or capsule form. So let's practice a question by using this formula. A physician prescribed metclopramide 10 milligram IV stat and pharmacy provide 100 milligram in 50 ml solution. How much medication should be administered by the nurse? Our desired dose is 10 milligram and our available dose we do have 100 milligram and we do have quantity in 50 ml. So if you break these number down your answer will be 5 ml. So give 5 ml is the right answer. Our third formula is IV flow rate drops per minute. We use this formula formula when IV is ordered with drop factor per minute. Okay, formula is total volumes in ml, total volume in ml into drop factor and divided by times in minutes. So let's practice a question by using this formula. A physician prescribed 1000 ml of normal saline to be administered in 3 hours. Our drop factor is 15 drops per. Nurse should adjust the flow rate per minute is. So first of all guys, you got to convert hour into minute. So we do have 3 hour in question and you got to multiply by 60 and you do have total 180 minute times in minute and then apply the formula. So total volumes in ml we do have 1000 ml and our drop factor is 15 drops per ml and divided by 180 minute, and if you break these number down your answer will be 83.3 drops per minute. Okay, and everyone know that we can't just write drops in point, so final flow rate is in whole number 83 drops per minute. It is just a thumb rule for math and for the basic pharma conversion rate. If your answer is falling in between 0.1 to 0.4, you got to round down your number, and if your number is falling between 0.5 to 0.9, you got to round up your number. Do not write drops in points. Formula number 4, infusion time. We use this formula when IV rate is given ml per hour and you need to find how long the infusion will run in hour. This formula is so simple and this is my favorite. Total volume of infusion divided by ml per hour. So let's practice a question by using this formula. A healthcare provider prescribe a 1000 ml of D5 to be infused at the rate of 125 ml per hour. How many hours will it take to be infused 1 liter? So first of all guys, you got to identify the values. We do have 1000 ml total and our rate is 125 ml. So apply the formula. Total volume of infusion is 1000 ml and our flow rate is 125 ml per hour. If you break these number down your answer will be 8 hour. So final answer, it will take 8 hours for 1000 ml to be infused. Some key point for reminder: if your rate is in ml per hour, your answer will be in hour. And if your rate is in drops per minute, your answer will be in drops per minute. If needed, convert hour minute afterward as I showed in formula number 3. Formula number 5, last but not least, infusion by unit dose per hour. This formula is pretty similar to formula number 2 that we already had discussed, only you got to one step ahead in this formula for double confirmation. Okay, the formula is D divided by A multiplied by Q. D stand for desired dose, whatever doctor ordered for the patient. A stand for available dose. Q stand for quantity. It could be in tablet form, milliliter form, mics form, etc. Let's practice a question by using this formula. A provider prescribe a continuous heparin at 1000 unit per hour and pharmacy supplied 20,000 unit of heparin in 500 ml of D5. How many ml per hour should the nurse set the infusion pump? First of all, you have to identify the value. Our desired dose is 1000 unit per hour. Available dose 20,000 unit in 500 ml. Okay, apply the formula. Our total desired dose is 1000 unit. Available unit 20,000 in 500 ml. If you break these number down, your answer would be 25 ml per hour. Guys, still if you are unsure whether your answer is right or wrong, you can always go one step further and double check your answer. First, confirm how many units are in each ml. First, confirm how many units are in each ml. To do that, divide the total unit by the total volume. That will tell you unit per ml. For example, if you have a 20,000 unit in 500 ml, and after that if you break these number down, that will tell you you are having a 40 unit in each ml. Now use the number to find your rate. So in this question you have order for 1000 unit per hour. To get your right answer, so you got to divided the desired dose divided by 40 unit per ml and you are having a same answer 25 ml per hour. Bingo, you got the same answer with the double confirmation. If you really like this video and you want the PDF, just comment PDF in comment section, then follow me on Instagram. Barcode is right here at your screen in front of you, and send me a direct message. I will send the PDF straight to your DM or at your email. Whatever is preferred, just don't miss it. Alright guys, that's it for the today's video. I hope this really helped you to understand this topic better. And if you are new to this channel and you find this content is useful, don't forget to subscribe, like and share this video with your friends. It really support the channel and also help me to create more video like. If you have a question or doubt, feel free to drop a comment below and I do check them. You can also connect with me on Instagram. This is my Instagram ID here. You can follow me and you can ask me direct question and we can talk one-to-one together, and I will try my level best to help you guys. Thank you so much for your support and I will see you in my next video. Thank you, stay tuned, stay healthy, and God bless you all.